I'm Dr. David Farthing. I am a neuroradiologist by subspecialty training, a radiologist by standard training. I've had chronic pain for over 15 years. It got bad enough it was affecting my concentration at work, and I went to go see a neurologist first. After a few months, I went and saw Dr. Polly Chen at Pain Care Specialists, and I was able to schedule the surgery when it was convenient because of the work he was able to do on me. The neuropathy was getting worse and the pain from spine injury was getting worse. The pain back then, the best way to decide when it was bad, when it was the 8 or 9, it's like someone is literally taking a knife or a spike and shoving it in your butt and down your leg. You know, it's very distracting and very incapacitating. The neuropathy can be from, like right now, it feels like my legs are a little tingly and a little hot. But when it's bad, it feels like I'm walking on hot asphalt. Or you occasionally, the fancy word for it is lancinating pain, somebody sticking me with a knife in my foot. And so I don't enjoy that. Polly was talking about using a thing called a neurostimulator. And I was not interested to start with at all. I saw 2 or 3 patients who had very severe pain that was making their life basically unlivable, and they were trying very strong narcotics without significant effect. And so I was impressed with, Dr. Chen's skill. And then the advantage of Polly and his people, they will say, okay, you're having side effects, let's try something different. And Polly finds something better. Dr. Chen, who was familiar with all the things and had the patience to find the right mix or not use drugs and use something else for patients instead. I've got one of the earlier neurostimulators in 2013, and that worked for years. And it was nice because I got to put off having any kind of surgery, and the amount of medications I had to take, I got to reduce significantly. And so I got to go on with life. I can recommend pain care specialists from looking at it from both sides as a doctor and as a patient. So I can recommend them easily. I've had a wonderful experience with you where I vote with my feet. I would have not gone back. I would not have recommended him to other patients. I would not have recommended him to other doctors. And as a radiologist, neuroradiologist, you see a lot of people who have damage to their bodies, some of which could use his skills, or don't think surgery is necessary. Then they should go see pain care specialists because the surgeon can't fix it or doesn't think it's bad enough. Now you want to see the pain specialist so that you can live your life.